I'm Dr. Jen Peña, and this is Doom Scroll.
Hey, Jen.
Hey, Tessa.
How you doing?
I'm good.
I'm talking to a lot of patients before they're heading off to college. And did you hear about Wesleyan University, what they're doing?
Yes, and I think, honestly, it's the feel-good news that we all need to hear right now. And I'm really encouraged that other universities are going to follow suit. So essentially, Wesleyan decided to cover the cost of abortions and emergency contraception for all students. It all came about because they had some student advocacy groups. So in particular for this one, I think it was the Wesleyan Democratic Socialist Group, if I remember correctly. And they, pushed for the school to offer these services because, as a response to everything that's been going on, right? Last year with the Supreme Court, Roe versus Wade reversal, and just, again, this issue with access to care, especially in the reproductive rights, area. And so, yeah, essentially they decided they're going to cover the cost of this. Now, obviously, they have to be fiscally responsible. So if there is a student that has insurance that already covers those services, well, certainly they're going to leverage that, right? But if the student, for whatever reason, doesn't have coverage for these services, then they're going to go ahead and give them that financial aid. Now, it's important to remember Wesleyan is in Connecticut, which is, where abortion is still allowed. So it'll be interesting to see how this develops potentially in some more, conservative states, and if some of the universities in those states will follow suit. So stay tuned. But I'm really excited about this. I'm really curious to see how this develops.
And they already cover contraception, right?
Yes, they were already covering, birth control. And, I think that that's super important too, because if you think about students going off to college and, well, heck, it was my experience. I'm old now, but back in the day when I was in college, right? Birth control became a thing. And I personally was terrified of going to get birth control under my parents' insurance. So I went to the student health clinic, and they still issued a prescription, and I had the option of cash paying for the prescription or going under the insurance. And luckily it was generic, and so it was cheap enough that I cash paid for it. But that was because I was afraid that my parents would find out that I was on birth control. And so, again, having Wesleyan be so progressive about covering these costs so that students don't have that extra added stress. I mean, it's stressful enough to be in college already, and you're trying to promote good, safe sexual health. I mean, I think that this is wonderful. And I hope, again, that other universities follow suit.
You've given me some really great talking points for my patients too.
I wish I was in college again. I feel really old talking about college students.
I loved college. I don't know that I wish I was in it again. I
could not have said that any better. Loved it to hate it.
We'll talk soon.
Thank you, Tessa. Bye.